Now, here's my approach to proof of damage. I call it the segmental approach. What we do to create a body of proof is we take this. We take each element of damage, each step along the way, each segment, and pre-impact terror may not apply. I've had some cases where it applied. There was a case in the classic on pre-impact terror is where the plane there was an explosion of the Air Florida plane, and it took it 7 minutes to land when everybody knows they're doomed. So the jury awarded $500,000 for pre-impact terror for that element alone of 7 minutes of mental anguish knowing that they're about to die. But okay, so you look at, then in any case, you look at the actual instant of terror, instance of impact, and you sit down with your client in the interview and you say, okay, I want to take you back now. I want you to think back to exactly what physiologically happened to your body at the moment of impact. And tell me, let's walk through it and take them through it. And they'll tell you what was broken, what hurt, what was your first notice that you had injury to this and this and this, and you go through the entire their mental anguish, their physical pain at impact. Now, we go through this process with each element of damage. So we take physical pain. Now, talk to me about your physical pain now. Then we come back and we go through all those same steps with mental anguish and do it separately. And you'll begin to develop a hell of a body of proof. Post-impact unassisted. A lot of situations you'll have where someone they have an impact and then they can't, they're out, no one's stopping to help them. The other party may be injured or dead. And we've had these cases where there's no assistance and they're there and there's nothing can happen. I had a case of a woman whose leg had to be amputated eventually, but her leg was crushed and she can't move. She can't open the door. She can't do anything. She's just sitting there in horrible pain for the longest period of time, 23 minutes to be exact. 23 minutes she can do absolutely nothing. And there's a lot of pain involved in that, and nobody could help her. There was nobody there to help her. The period of peril. There's always a period of peril, quite often a period of peril, after the first impact. There's the peril of somebody else hitting your car. There is the fear of the peril of the car blowing. If you're not extricated from the vehicle, there's the fear that the gas tank's going to blow up, that there's going to be a fire, that you're going to burn to death. I have to tell you about a guy I represented that illustrates 2 or 3 of these points. I had this big Texas construction worker, and he rode a motorcycle, and he was riding his motorcycle home from the construction site one night, and there was a brand new coverage of asphalt on the highway that they just put down that day. And when the workers left at 5 o'clock, they sort of forgot to put up the barricades. He happened to be the first guy to come along. He goes off into brand new asphalt. His bike flips. He is thrown, propelled rather fast, on his back and his butt across that, literally just being thrown across that fresh asphalt. And at the meantime, the bike is flipping over. When he finally stops, the bike lands on top of him, breaks his leg. The gas tank is busted, and now he's laying there with gas spilling out on him, and his leg is broken, and he can't move. Oh, and he also had shock to his spine, and he can't move. Okay, he can move enough to look and see that there's a car bearing down on him. This is a period of peril. He's sitting there. He could burn to death in any second now. He could be run over by the oncoming vehicle. All sorts of things. Okay, so is there mental anguish involved in that? I think so. Is there physical pain involved in that? Yeah. The woman the car who came right behind him, when the next people came up and they stopped, they came up and they testified that she was sitting in her car gripping the steering wheel, and she was screaming at the top of her lungs. She thought she had hit him. She was that close. He was actually under her front bumper. She didn't contact him, but she thought she'd killed him. because he wasn't moving. She couldn't see anything out there. She thought she'd killed him. Period of peril. People often get hit on highways. It actually happens on highways, and there's oncoming traffic. The traffic's still flying by on the interstate, but yet they're right there in a danger zone. Mental anguish. During rescue, remember this, that during rescue, whether it's by EMTs or by Good Samaritans, there's no, people will often have the best of intentions, but they can cause a lot of pain and mental anguish in the process too. The fellow who was in the car, he had 2 broken scapulae, and he had a fractured leg, and he had bad back injury. So people came up, and they came over. They were worried about the car catching fire, so they took him, and they reached up in under his arms where he had 2 fractured scapulae. They didn't know. So they pull him out in a hurry because they're really worried about the car catching fire, and they dragged him away from the car. So he's bouncing along the ground with these guys holding on to his, and he also had fractured ribs, rib fractures and scapulae. Pain involved in that? Yeah, I think so. And so look at what happens during rescue, because a lot of times during rescue and at the scene, you'll find that the EMTs will come, but they don't worry. There are all sorts of cut downs that occur. There are all sorts of things that happen with scalpels at the scene. There are a lot of things involved in the rescue process itself. One of my clients was hit by an 18-wheeler, and the bumper, or the fenders rather, were crushed in, and the metal was impaled into his legs, and they couldn't take it. They couldn't take him out at all, and he had to wait there until they got there with the jaws of death, and they take the jaws of death, but they can't pull the fender out, but they can't take it out because it's really deeply into his leg. And I mean, just think about the physical pain involved in that. They're trying to pull this metal out, and I mean, that's pain and suffering. Also a little mental anguish, and there's always the mental anguish that goes on with that type of injury also. During transportation, the same thing is true. You get the EMTs, some of your best witnesses, some of the best witnesses I've ever had on physical pain and suffering, and have been the EMTs, the people who are at the scene and then taking them to the hospital, talking about all the problems that they had and all the dangers that they were in during transportation. In the case of our young man who had he thought he was quadriplegic with good reason. He did have a spinal shock, and they put him on the stretcher. They anchor his neck down, and he knows what's happening. They're fixing him so he can't move. And then they take him by ambulance to the local hospital in Hidalgo. The local hospital says, this is too serious for us, we can't handle it. So he had to wait while the Medijet comes to get him and take him to Houston. They take him to Houston. They have to transport him by helicopter from the airport. And so this whole time, he's being treated by the professionals as a quadriplegic, and he thinks he's quadriplegic. He wasn't quadriplegic, but imagine the mental anguish this guy's got. His wife is dead. He's just seen this horrible picture of her in his mind, decapitated, and now he thinks he's quadriplegic. He's got enough real injuries without the quadriplegia, but that's huge, huge. And this is hours by the time they finally get him into to the first relief. The emergency room care is often the same thing. Look at what happens in the emergency rooms in terms of pain and suffering and mental anguish. The time to first relief. This is an interesting calculation, and I've seen it run as long as 18 hours. The question is not how long was it between your injury and the time you got to the hospital. The question is, on the issue of pain and suffering and mental anguish too, the question is, how long was it from the time that you were injured until you first got relief, which is to say something to reduce your pain or something to try to control your mental anguish. Because what happens is when they get to the hospital, the doctors are concerned with differential diagnosis. So they do not want they don't want to relieve your pain because physical pain is a very important differential diagnostic tool that doctors use to say, does it hurt here? Does it hurt here? They don't want to, if they stop the pain, you can't tell them where it hurts. So you'll find, I found in one case, I said, that it was actually 18 hours from the time of the really, really bad injuries until they finally got this person to where they could get them into bed and put a morphine drip in to start trying to relieve their pain. That is a lot of time of very severe pain and mental anguish. Major versus minor injuries. I'll show you this in a minute in a graphic, but we often make this mistake. You get a person with a major injury like quadriplegia, and they will have all sorts of other injuries, but you just focus on the quadriplegia because it's such a big injury, and you don't think about all those other little fractures they had. You don't think about the pneumothorax or the other fractures. So here's what I learned this a long time ago, and we've always done this. We get a quadriplegia case or a paraplegia case or something of that nature. I'll take an associate and say, okay, here's what I want you to do. You take this file and you leave out the paraplegia, but you evaluate this case for trial and for damages and for settlement prospects based on everything else that's wrong with this patient, so that you work up every single solitary thing there is, every minor injury there is, you get a cumulative total on those and evaluate it that way. Then you add the paraplegia in, because it's very easy. You can overlook lots and lots of money for minor injuries because you're so focused on nothing but the major injury. The next is treatment and therapy. There is so much, a lot of times, and you have to go into detail. This is where your nurses come in and your rehabilitation specialists. But the fellow who was thrown off the bike, there is no way he would ever say under any circumstances that he was experiencing physical pain. It just wouldn't happen. He was just too damn tough for physical pain. But what happened to him was, I have an RN JD who has been working with me for about 37 years now, same in your class actually. She was going through the medical records on this guy. I told her, I said, read she'd go through and read every page of the medical records, every entry, and say, find instances in here of physical pain, mental anguish, reflections of these damages. And so she comes back in, she says, well, this is significant. And what it said was, there were 4 pages there were entries on 4 different pages, a nurse's entry. And all it said was, BET times 2. BET times 2, BET times 3, BET times 3 over a 4-day period. She said, this is great stuff here. And I said, okay, well, let's go talk to the nurse. So we went and talked to the nurse, and she explained to me that means a betadine scrub, but there's a reason for it. So we talked to the nurse, and the nurse's testimony was this. She said, that is a betadine scrub. She said, what I have to do is I have to go in. He had all this fresh asphalt embedded in his back. I mean, deeply embedded in his back and in his butt. And she said, I had to go through and I had to take tweezers and dig down in and just dig that asphalt out and just dig it out. And then I'd take the betadine, which is an antiseptic, and I'd take that and I'd scrub him down with it. Then I'd have to go through and dig all that out. And I said, well, why did you have to do it 10 times? You had 2 2s and 2 3s. And she said, oh, you couldn't possibly tolerate that much pain to do it all at one time. He had it all the way from up here, all the way down his butt. And she said, no, he couldn't possibly, I wouldn't put a patient through that. And I said, well, explain it to me. She said, well, he's stretched out, he's on his stomach, and I'm in there, and I'm telling him. And I said, I wrapped up a towel, folded up a towel, and I said, okay, bite down on this. He said, what's that for? And he said, I don't want you to cry. I don't want you crying out and screaming. And he said, I'm not going to scream. She said, no, this is not for you. This is so you don't disturb the patients down the hall. So he bit down on the towel, and I said, okay. And did he scream? She said, he screamed into the towel, but he cried like a baby. Okay? why did you have to do it? And so we went over how long, and she did this 4 days in a row. So the treatment itself, I mean, that's huge, huge damages in that particular case, in a lot of cases. And then there's a time between treatments. There are a lot of bad treatment courses that patients have to have in hospitals. So just like this guy, he gets his first day of treatments, then he's got to lay there and think about, boy, I got to do this. Here comes the nurse again at 3 o'clock. But there's also this. I had a case in which a truck driver was told that he had a risk of he had a risk of dying, and that it was gangrene, but they had to stop it. He said, you know, we think we should take your leg off. It's possible you won't lose your leg, but on the other hand, if you don't have your leg amputated, you could lose your life. So they came in, explained it to him at 3 o'clock in the afternoon. They said, okay, he said, man, that's a tough decision. So he said, we'll be back in here at 7 o'clock in the morning, and you let us know, we'll proceed or not. So here from 3 o'clock in the afternoon till 7 a.m. the next morning, he's got to decide, do I want to have my leg amputated, or do I want to just take a risk, in which case I might die? That's tough. I would imagine there's some mental anguish involved in that. The next is informed consent. Did you ever read the informed consent form? You should. The informed consent form says you'll be put under general anesthesia, which can cause brain damage, and then it goes into all these other things that can happen. You may have to be given blood transfusions, which could possibly cause AIDS. I mean, literally, it could possibly cause AIDS, and it goes through all this. Then it says, of course, you may not have to worry about it at all because you may die. Here, sign here, and we'll see you at 7 in the morning. Have a nice night. The informed consent thing scares the hell out of patients. You talk about causing mental anguish, it does. Preoperative testing, find out exactly what preoperative testing they underwent, because the testing, quite often, you take someone who's got fractures all over the place, and they have to put them in just for x-rays. But to get x-rays, they have, okay, we got to put you in this position. You know, there's a lot of pain. It might very well, if you got somebody with rib fractures, something like that, when they're x-raying, they don't know what they have yet in most cases. So just look into that. The next thing is in surgery. Do not assume that because they were in surgery that they were under a general anesthetic. Spinal blocks, there are all sorts of surgeries that are done now without general anesthesia. Also, there are also surgeries that require, even brain surgeries, that require that the patient be awake and communicating. And so, you know, here you are, you're awake, and you got this guy playing around in your brain up here and asking you questions. Or there's some cases where they use a spinal block, and they say, okay, you know, what's that I smell, doc? Well, that's your skin burning. I mean, it can be terrible mental anguish in cases that do not involve general anesthesia. The postoperative recovery is always a frustrating period in many types of, in physical trauma, it's usually a very frustrating period. Then we get into what we call prosthetic frustration, which is when you get someone who's, all of a sudden they're having to learn to walk all over again. And there's so much frustration. And first they just have to learn to stand upright. Then they have to learn to take a step with rails. The whole frustration of using a prosthesis and having to be trained to work, there's a much mental anguish. So this all comes from rehab people, and they call it the anguish of assimilation. The whole process you have to go through to assimilate from being a healthy, full-bodied person into being someone with prosthesis who has to learn to live without an arm or a leg, or in one of my clients, 2 legs, a double amputee. So those are segments that you look into. Then you go to the rehabilitation process, and in all of these, the rehabilitation process is hard, it's frustrating, it's a major source of mental anguish. Then you talk to the spouse, to the family, about when they return home, they can no longer perform what they used to do before. This is physical disability. The inability to perform the task that you could perform before that does not require wage earning. Are recreation disabilities, those things that you used to do for recreation that you can know, that's all part of the damage element of physical disability. These are often overlooked. You can build up quite a substantial list of things just on the physical disability element. Return to the workplace. Then you go back and talk about damage to wage earning capacity. You talk to the employer, talk to the co-workers. What were the things that this person used to do that they can no longer do now because of this injury? And you get help on that from the workers, co-workers. Future damages. You got your life care plan. You calculate the current life expectancy. I always plead future damages. And in my years of teaching damages, I always told my students, I said, always plead future damages, because if you plead them and you don't prove them, no harm, no foul. But if you don't plead them and you try to prove them, you may run into problems on a trial amendment or something like that. So always plead future damages. So we hired a guy who'd been one of my students, and one of my associates came in a few months later, and he said, "Boy, he took you to heart on that pleading future damages thing." He said, "You need to read this." And I read this paragraph, and it said, "Decedent has incurred funeral expenses in the past, and in all reasonable probability will incur funeral expenses for an indefinite period of time in the future." And so I called him in, and I said, "What are we dealing with here, the eternal flame?" And he said, "No, the suit was rented." So on your future damages, your life care plan, and everything, that can be so much money, and it's so often overlooked. Now, look for your collateral sources, your PIP. A lot of these are often overlooked. Just look for every possible source of money when you're getting into damages. Look at every way you can get medical help, any types of benefits.